Welcome to today's podcast, H.O.T Talks. In this episode, we'll be diving into the realms of AI, technology, healthcare, and management, and lot along the lines that sure to pique your interest. We'll explore new ideas, delve into intriguing stories, and hear from experts in their respective fields. Today, we are joined by a very special guest, Dr. Vidith Phillips, who works at Beyond as a product specialist, digital health, focusing on leading digital health product development, research, and user experience design for optimization. He will be sharing his unique perspective and insights on the subject at hand through thoughtful discussion and thought provoking questions. We'll uncover new perspectives and gain a deeper understanding of the topic. So sit back, relax, and enjoy this episode of our podcast as we take you on a journey through the work of knowledge, ideas, and inspiration. So, before beginning, I'd like to know how you feel about being on this podcast.
Thank you for hosting me. I think this podcast series started by VIT Bhopal is a really good venture. Since digital health and health tech is a area still yet to be explored by most populations, and India is still catching up. And the initiative you guys have taken on this is a really fascinating one. To actually get the information out to the students. So commendable, approach there.
Right, that's great. Thank you so much. Moving towards our first question, would you mind sharing your journey from being an MBBS student at Christian Medical College and hospital to being a digital health product specialist at Beyond?
So, so my journey would be, I would say, quite unconventional because, I mean, in India, still anybody from the MBBS background jumping into tech is quite rare, let alone actually go about analyzing the space. So, initially, from like the second year onwards, I had quite an interest towards the tech side of things and really wanted to understand how, the health tech space worked and, what could be the possibilities in it. Back then, you were seeing many health tech companies coming through. The COVID pandemic hadn't happened, so you were hearing names of Practo. You did not really know what it was back then. So I was doing my due diligence at that time, and then slowly started building up my tech knowledge. Just started learning how to understand the basics of something like Python and Ruby, and basically understanding the ins and outs of it. So basically, I educated myself in that space. It's post med school is where I actually transitioned. So for a couple of months, I was actually working in psychiatry as I wanted to learn the ins and outs of psych. Then that year, I took actually to deepen my knowledge of health tech and actually understand what digital health was all about. Eventually, I made my transition to a clinical lead position in Triple IT Delhi, where I was leading a couple of AI-based projects in health tech for the computational biology lab there. So we worked on a couple of public health related projects, ranging from AIMS to various NGOs in the maternal and child healthcare space, as well as like the Crohn's disease space. Basically, I worked in that space, and then eventually, I think last December is when the founders of Beyond reached out to me. They were looking at building a digital health offering based out of Bangalore, and primarily looking to build for a specifically health focused audience who want to optimize their blood biomarkers and really take their health as a preventive space. So that is where I joined Beyond, and today here we are.
So it's great listening that it's like a roller coaster ride for you till now. A lot of things happened, right?
Yeah.
Next question is, working as a digital health product management manager, what are the most exciting or challenging aspects of your job?
Okay. Uh, since I come from a clinical background, my experience with product management has been, uh, kind of different than, how people usually take product management, because to enter the space is you need to either have an analytical approach or you have to have a, business first approach when you take on product management. And especially now when you integrate healthcare into the mix. So product management, or, any side of business or entrepreneurship itself is complex. Then you add in healthcare, it becomes even more complex, because, the rules and regulations come into play, and that's where you need to be very careful. So primarily in digital health, as a product manager, my experience has been quite a learning experience, actually. I've had to, really get into the user's mindset of how to go about, building a product which will be not just eye catching for them, but also as, really driving their health in a preventive space. So beyond, we primarily aim to achieve that. We have made quite a range of, product offerings in the last couple of months, and we're still, just in the initial stages of this. So hopefully this will just, go on from there.
Right. Okay. So, would you like to share any strategies for the students who wish to pursue or are pursuing their career in this sector?
Okay. So when it comes to health tech or digital health, the ideas that one should look out for primarily is to, have an iterative state of mind. Basically, constantly keep learning, because now when you, enter this field, the digital health space in India, especially with the advent of ABDM, has just, taken by storm. And in the next, let's say, 5 years, it's going to keep rapidly changing, with new and new regulations coming through, and new entrants into the market. So for any students looking to enter digital health or health tech, I would say that you do not just focus on the technical, know-how of this. You also try to gain an edge by actually walking the, line in between health and tech. So that is primarily the space I've also tried to operate in. So at an interdisciplinary approach, you build your knowledge in, definitely you have to build your knowledge on the tech side of things, but you try to understand from a healthcare perspective what the user wants, what should be made versus what can be made, and then from a business standpoint, what is the most feasible approach to take forward, as well as for scaling. So I think that would be the key fundamentals I would look at.
Fine. Next question is, the attempts you are making to simplify digital health for people through your posts on LinkedIn is really praiseworthy for sure. And when and how did you think of doing this?
Okay. So this, I think this just came about as a need of actually trying to explore the space of health tech. I was looking at material online. I was reading, doing my own due diligence, self-studying in the space that, okay, what else is here? What can we understand in digital health? But the issue was, uh, there's a lot of information present today, but what does a common, person really make sense of it? How do they make sense of it? So that was my approach here, that, I just don't limit my own learning to whatever I could find. And I try to translate it into a simplified version, so that even the folks from tech who are, wanting to understand the healthcare side of things can understand this, information, as well as, people from the healthcare space, clinicians who really want to understand, okay, how do they move their careers into the tech side, can really, go about exploring the information. So I did start a series there by the name of Simplifying Digital Health. And I think about till now I've gotten like a good 5-6 posts there, but yeah, I plan to continue it going forward. Yeah.
Okay, okay, fine. So, what inspired you to pursue your career as a product manager at Beyond?
Yeah. So, product management space, I primarily decided to make a shift. So, after working for a year in the academy and the research side of things, I really had a good grasp on, how research and AI, basically AI research, basically works in the academia space. I wanted to understand what is the day to day in the industry. So, product management became the next best bet there. Initially, I had the options to move out into the pure managerial side of things, but product is where you really, get your hands dirty. You basically get to, build out the offering. You interact with your user. It's a constant iterative cycle, and that is where you're closest to the end user, and that is, the realm that I really wanted to go into. And anybody looking to go forward into this space, I think two factors are very important that anybody should pay attention to. One is your end user and how much do you interact with them, how much your product is fine tuned to that. Second, how different it is from the product offering that are already existing. So if you're not building for let's say a 4x 5x difference, it's not really worth it then. So that has just been my experience in product management.
When we were going through your profile on LinkedIn, we found out that you have volunteered in many social campaigns. Would you please share your experience about them?
Sure. So my volunteering experience actually started back in college. Back then, we had various, student organizations that were working in different medical colleges back then. My college, CMC in particular, at that time barely had any student organizations that were existing there. So what we did was, with the help of partnering organizations like MSAI, IFMSA, we basically brought in an organization by the name of AMSA, or Asian Medical Student Association. So that is where I primarily led the executive board for that organization, and really reeled in our volunteering efforts. So our volunteering efforts really focused on blood donation drives and charitable donation drives. So in I basically started 5 years in Punjab, and Punjab has a really bad problem of condition by the name of thalassemia, and thalassemia requires a lot of blood donations and blood transfusions. So that is something which we primarily focused on. That okay, regularly every month or so we would engage the students in a donation drive or some sort, and basically that is how we started.
That is very nice. Next question is, as someone who has excelled in web design, what would be your tips for our future genius web designers?
I wouldn't say I've excelled in web design. I think I have a fundamental knowledge of it. But I would definitely say that when it comes to web design or app design, also for that matter, the thing which really matters is you take every approach, take every next step from the user's perspective. That you do not just try to build out the fanciest looking app or fanciest looking web page, because does your end user actually understand it? Can they navigate through it? What is the cognitive load there? So these are the factors that are the most important. Anything above that, when it comes to the aesthetics of a web design, anybody can really build it. It's not really that difficult, especially in the day of chat gpt. You just write in a code, you don't really have to try also on it. But the user understanding, that is where your differentiation comes in. So be it even a research project or research related design, the end user or the principal investigators really have to understand how to navigate through your design, basically. And I think that is key here.
So you are saying that designing a model is not a rocket science.
I would say now it is becoming lesser and lesser, difficult to actually design something which is, extravagant looking, but then will it be functional enough? That is where, the difficulty comes in. That is something, an AI bot can't really do for you, because they don't understand your end customers.
Right.
That's what.
Um, when we were searching about you, we got to know that you are a member of IFMSA and MSAI. Would you mind sharing your journey of accomplishing the same?
Okay. So again, like I said, these things started, these organizations I became a part of back in college. Um, I was engaged with MSAI for a bit, but actively I was engaged with AMSA there, and that is the space that we really navigated in. So um, I think bringing in a student organization was one of the most key factors in basically my journey through med school, and how we navigated through it. That because before we even brought in a student organization, things are usually scattered. But once an organization is set up, a chapter you set up in your own college, that is where students get more engaged. They get ideas on how to really build for it. So with AMSA, I served as their director for exchange programs for a couple of years there, and basically led the executive board and different spread of the organization in during the college years. So that was a wonderful experience. Got to really interact with various med students from South Korea, various med students from Japan. Built a good interaction between CMC students and other colleges. And I think that is where that student organizations and basically like interaction of inter-college and inter-country colleges, basically that is a key factor in developing relationships. Yeah.
I myself am my BTech student, computer science specialization in artificial intelligence. So actually, what happened? I was also focusing on doing MBBS. So what happened when I came to 10th standard? I realized biology is not my subject. I was not able to cope with the subject at all. So finally, I decided, convinced my parents somehow that I'm not be able to do this subject. So there was not an option for other subjects. Mathematics was left. So I took mathematics. And then when I came for BTech, this our college had specialization. So I opted for artificial intelligence. So here also, I've joined this health tech club because that route I missed, MBBS route I missed. But somehow, if I'm able to contribute to this sector, health tech, so that's why I've joined this club, and I'm
That's
like
a great initiative there. I mean, see, the thing is, I mean, if you are really interested towards the healthcare side of things, you don't need to go through the MBBS route. And that is, people don't understand this today because everybody thinks that if you're a clinician, then only you can contribute to healthcare. That's it. Healthcare is a very big industry. There are so many options available. And health informatics is a very upcoming field. So yeah, if you guys are concentrating on that also, you know, you set yourself up for success for the next 5 to 10 years at least.
right. Yes. Okay. Having skills in business strategies and team management and leadership, what would be your advice to our future entrepreneurs?
Okay. I'm not an entrepreneur yet. I would say, but I've interacted with quite a lot of them, friends with also quite a lot of them. The thing is, one, you have to have the, mindset for it. Not everybody is cut out to be an entrepreneur, especially in our country, because, the environment is not that favorable. It's turning into a favorable environment in the next, 2 to 5 years. But the first is a mindset that, you really have to have that gritty mindset that, okay, you can build through anything. And then the second thing is you really understand your market there. So let's talk about digital health, right? The landscape in India is, rapidly changing. You see the last 2 years, you see the last 5 years, it's drastically different. Take 10 years from now. It was people barely knew about telehealth. But now everybody, just accesses telehealth first and then probably goes to a clinician for anything. So markets keep on changing. You have to keep analyzing the markets. You have to keep keep yourself up to date. You have to keep reading thoroughly, every single day, try to read something, just to keep yourself updated. So I think those are the two things which are the foundations of any sort of entrepreneurship. And then secondly, you should understand from a business perspective how businesses actually run, because just because you can make it doesn't mean the market will respect it. And that is something we are fundamentally not taught in our educational systems, that okay, just try to build something or try to build something extreme, but that may or may not suffice in the market. Something, even a simple idea with a good execution can actually survive, but a complex idea usually dies out without market adaptation. So those factors, I think, are key to understanding. And yeah, I think just go for it mostly. I think that is the final approach for it.
Right. So that reading phase includes reading about technology as well as that health related problems also.
Yeah. So I think it's a constant. I mean, it's you never really have a phase for it. You can't really stop educating yourself if you really want to go into the entrepreneurship space. So the best way to actually, I think, tackle this problem is, especially in healthcare, right? The thing is, you find a health problem, right? You find a healthcare related problem. You see what the existing solutions are. You see what can be done differently, and that is where you bring in the technology. You don't lead with technology first, and that is, that rarely works in the digital health space. um, Plenty have tried to, start with tech and then, okay, we'll build for a healthcare audience. Never really works, because when it comes to healthcare, right? So I think I categorize it primarily in two spaces. One is basically the preventive side of things. Okay, that, we're working in the wellness space, that, okay, we would advise you something, but that's it. And then the second digital health, space, basically that operates is the curative side. So let's say you have XYZ condition, and then I come up with a treatment or a diagnostic, modality for it, and this is how you can treat it. And that is where it becomes tricky. That is where the difficulty comes in, because you have to, really prove that your solution is, let's say, 5x better than what is already existing. And then you have to make sure that it passes through the medical regulations, and that it's adopted, and there are no legal implications again. So I think that, the whole navigation of this space is something which has to be very thoughtful. That, you can't really, people have this idea that, move fast, break things, that kind of ideology that doesn't work in healthcare. You see any good companies in healthcare, they're not working in this space. You see even the tech giants, after, years of uh, dominating the tech industry, Apple and Google, now they are making their significant transitions into healthcare. Even Amazon, for that matter, now is it when they've started moving in, and they are also treading, very carefully. They're not trying to, build something which is extreme, because it may or may not result in a very good outcome. So I think constant learning there is, absolutely necessary.
Okay. So here comes our last question. At the end, would you please highlight some key points according to you that need to be remembered by enthusiasts interested in developing AI in healthcare?
Okay. Okay. When it comes to AI, right? Um, AI itself is picking up pace pretty fast, and uh, in, like, let's say a year from now, AI will be very different with the advent of, let's say, what, Chat GPT or GPT-4. I mean, we've seen, how drastically everything has changed. Things we did not even, think were possible 6 months before are possible now. So when it comes to healthcare, and there will be plentiful applications of, such technologies in this space. The best things to keep in mind is, you keep a healthcare first approach. You try to understand what the patient's needs are, how you can augment actually the clinical flow, because anything which tries to actually disrupt the clinical flow in most things, and these are primarily for clinical interventions, they end up becoming rejected. So, as an example, I mean, a decade back, actually, so many EMR, EHR systems came into play in the US and Canada and North America, right? Uh, and at that time, they promised to be absolutely revolutionary, and that, that they'll take it by storm. What ended up happening was, even these far advanced technologies, they were, causing a very, very, roadblock of a situation in the clinical outflow, and they did not get adopted. Similarly, today, new versions of EHR systems with, with inclusion of ambient health intelligence, these are coming into play. But how do they integrate well with the healthcare scenario, that is of, key importance. That is something anybody should actually try to understand before they try to build something here, because building for healthcare is, you really can't do it within, let's say, a 2 months, 3 months duration. You have to put in that, a good time and effort to it. Do your market analysis, do your research, and see what the existing solutions are. I think, that is most important thing in this space.
Okay, so that brings us to the end of this episode of our podcast. We hope you found the discussion informative and insightful. and that it gave you a better understanding of the exciting developments happening in the world of digital health, AI in healthcare and technology. We'd like to extend a special thanks to our guest, Dr. Vidith Phillips, for sharing his knowledge and expertise with us. Their insights have given us a fascinating glimpse into the future of healthcare, and we look forward to seeing how their work continues to shape the industry. Thank you for joining us, and we hope you will tune in again soon for another episode of our podcast. Thank you so much, sir.
Thank you for having me. Thank you.